Hi, this video is the hair transplant restoration surgery on a woman who inherited a high hairline in the receding corner and she had it all this for years, and when she tied her hair up, the corner really bothered her, and so our goal is to lower the hairline and create a feminine hairline. And once you lower the hairline and do it in the artistic and aesthetic way, and make it very natural, it will transform the look of the overall face, because with the lower hairline and frame of the face, it really enhances the eyes, the nose, and all the features that God created. In general, a woman hairline is a lot more complicated than men, but it can be done if you pay attention to every single detail. There's quite a bit of difference between the woman hairline and the man hairline. Number one is from the mid-eyebrow to the hairline is a lot lower than men. For men, the lowest around 6.5 centimeters sometimes, but for women you can go as low as 4.5 centimeters, up to 6.5 centimeters. And that's long, so overall proportional to the face. The mid-eyebrow to the hairline is a third, mid-glabella to tip of the nose is a third, tip of the nose and bottom chin is a third. The other important factor is the temple. If we don't bring in the temple for women, just have a lower hairline only, then you have a wide forehead with a low hairline. That's not very natural. We have to bring the face, the temple in, so it really frames the face better. And the woman overall has a little bit slight arch that if you look from the far distance. Now let's talk about the temple. If you turn this way for me, as you can see, her temple hair has gone back pretty far back. Where the eyebrows end, that's where the temple should be. So we brought in the temple quite significantly for her. For men, where the eyebrows end, you can put a finger breadth, and that's where the temple should start, somewhere around there. Number one. Number two, the angle for a woman versus for men are different. Woman temple angle forward, but for men, the Caucasian man most acute pointed backward, Asian man's less, and black man's perpendicular. For all women, their temple angle forward, and it closes the corner better. And then the zigzag is wider and higher in amplitude. And then once we get the shape down, we would try and find a very precise angle of 35-45 in the front, increase when you go backward, and changes when you go a different direction. The temple is really unique angle, is really flat against the skin and pointed backward on both sides. Not only the precise angle is important, the selection of hair grafts is important. We try and plant rows and rows of single hair graft in the front, followed by root 2 hair, 3 hair, and 4 hair in the back for both in volume. So the angle of the selection of hair grafts is important, the angle is important, but the zigzag is really important too. And as we mentioned already, there's quite a bit more details, but the most important factor is you gotta frame the face lower and bring in the temple quite a bit. And we'll be doing at least 2,500 grafts, somewhere around there, and trying to fill in as much as we could. The surgery will probably take around 12 hours, could be 10. It just depends on how much hair and how difficult it is to harvest and place. So this is the art of hair transplant restoration surgery on a client with a receding hairline and corner, and creating a feminine hairline. Thank you.